I just recently had a patient who had a lot of chronic diseases, came in and needed a major abdominal surgery, and was actually in the surgical ICU before I ever met her. And had been in the hospital for weeks, had been in and out of the ICU more than one time, which this is someone who was lucky to leave the hospital. This is somebody who was very, very, very sick. It is like fortunate that she survived. The abdominal surgery went really well and she healed really nicely from it. But we were tasked with optimizing her respiratory status so that she could go to some sort of rehab after the hospital. Clearly, as somebody who cannot go straight home, this is a classic, you need to go to rehab after you leave the hospital. And there's different tiers of that. You can go to a subacute rehab or you can go to acute rehab. Basically, our physical medicine and rehabilitation specialists evaluated her and said, this person needs acute rehab. This is an MD who specializes in this kind of placement. That was what she needed. But she has Medicare Advantage. And so Insurance Auth steps in. Her Medicare Advantage plan looks at the place and says, no, she's healthy enough to not go to acute rehab. She doesn't need to go there. This is someone who miraculously survived this hospitalization. The only thing that's going to keep her out of the hospital is going to an acute rehab. And you're telling me, having never met this patient, that we're incorrect in that assessment and that she doesn't need this care. That one's particularly relevant because I know traditional Medicare covers this kind of thing. Had it been traditional Medicare, she'd have been okay. And so we got this urgent page from our social worker saying they're willing to let you have a prior auth conversation, but it has to be like today and by this time. We had to drop all these things. It's offensive. It's very difficult to have your judgment questioned by somebody who's never met the patient and whose interest is not in the care of that patient. It's in the distribution of these resources that this insurance company deems appropriate.